is Asbar Masroor. I'm gonna be doing your trach suctioning today. So from the get-go, we're gonna check with the doctor's or the provider's orders that the patient does have trach suctioning ordered for them. We want to make sure the patient is the right patient, right date, right time. When we're done with the checking the doctor's orders, we're gonna come in the room, introduce ourselves, be like, "Hello, my name is Asbar. I'm gonna be your student nurse. I'm gonna perform your trach suctioning today. Can I have your first name, your last name, and your date of birth? And do you have any allergies?" So we're gonna verify that with their band, and then we're gonna come here to the portable pump. For portable pump, we're gonna be looking for 10 to 15, and then for a wall suctioning pump, we're gonna be looking for a 80 to 120. We're gonna turn our pump on. Grab the hose first, then turn the pump on. We're gonna just kind of turn it on, put our fingers through it, and kind of make sure it's suctioning properly. And we're gonna shut it down. And then now we're gonna come to our trach kit. Open this up. So I'm gonna come here. I'm touching the inside, so keeping sterility. The outside. So now we're gonna this is sterile. Now this is sterile. So in real life scenario, I wouldn't be talking over my sterile field as a reference, and then I would keep my hands above my waist. So this is all sterile. Set up my sterile field. And then I would check to make sure that the saline solution doesn't have any residue inside it. I'm gonna check the expiration date, that make sure that it's not expired. Start off with this tube. So I'm going to clamp it with my non-dominant hand. Or dominant. Now I'm gonna remove the mask. And I'm gonna hook this up to this. Now this hand is non-sterile. Hook it up to this. And now, maintaining sterility, I'm gonna turn on the pump. I'm gonna dip this in the saline, kind of lubricate the end, and I'm also gonna hold it up in front of me, and so it doesn't touch. So this hand is non-sterile, left side, and my right hand is still sterile because I haven't touched anything with my right hand. So we're gonna touch it. We're gonna kind of lube it up and kind of give it a little easier barrier to get inside the patient. And then we're gonna slowly put this inside the patient's trach. We're gonna insert it until we meet resistance, and then after we meet resistance, we're gonna slowly rotate it back out in a circular manner and kind of gently suck out all the secretions. And then while we're doing this, we're gonna assess the patient's O2 stats. If they're hooked up to a monitor, we're gonna check the color. If they're cyanotic or they're gray, do they feel better? And we're also gonna encourage the patient to cough as we suction them. And then we're gonna take it out, and then we're gonna let them catch their breath, let them get a deep breath, fresh breath, and assess them after and see how the O2 levels change on the pulse oximeter, and if they're hooked up to the monitor, see how their cyanosis or their color and their O2 stats, if they're getting better. We're gonna come back on the saline, kind of clean that off a little bit, and then we're also gonna keep doing this while we're suctioning. So we're gonna put it back in, put it all the way in until we meet resistance, and then we're gonna go a little bit further in and just kind of keep your thumb on the port, kind of take it off, and then you kind of gently take it out like that. And then we're gonna encourage the patient to cough as we suction them. So we can only do it, the saline dip, and then use the same tubing twice. If you wanna, and then that should be enough, but if you wanna do more, then you have to get a new trach kit. We're gonna turn everything back off. Put the patient's oxygen back on. And then after that, we're gonna take this off. We're gonna discard that. Put this back here. And then we're just gonna kind of assess your patient again after and see if the suctioning did anything. And in a real life hospital setting, you would see them, they're doing a lot better. Check their skin color, check their O2 stats. And then, we're gonna go document after that. We're gonna discard everything and document. Oh, and in this scenario, I didn't have a gown, but you're supposed to have a gown on. So just in case, if the patient coughs, you don't want that sputum to get on you, and you want the face shield as well, with the mask and the face shield. And that's it. And we're gonna clean, wash your hands, and then document.